The word euthanasia means good death, and to help a pet achieve a good death, there are a few short steps we have to take. When explaining those steps, I like to start at the end because that's the common thing that all veterinarians do, and it's probably the thing you're most familiar with. That's giving a big bolus or a large dose of a drug called pentobarbital intravenously or through a vein. And some veterinarians will just draw up the pentobarbital directly into a syringe and give it quickly and easily. And that's called the direct method. Now, there are reasons that I'd like to explain why I don't prefer that method. When you do that, you're putting a rigid needle attached to a rigid syringe into a soft patient. If the patient happens to move or the doctor happens to move at all, I think you can easily understand how movement of that needle can cause tissue trauma, laceration of the vein, and inability to give the injection quickly and easily like you had planned. So to avoid all that, we place a soft intravenous catheter, which, although it doesn't eliminate a needle poke, it requires a needle poke just like the syringe. It, at least once it's placed, provides a soft and secure access point where that injection can be safely and effectively given without worry of any of that trauma happening. However, to get the catheter placed can even sometimes take a little bit of work. And to help us with that, we give the pet a small dose of a sedative and pain reliever first called Tilazol. I choose the smallest amount I can on the smallest needle so as to minimize patient discomfort. And I do feel that after that step is taken, that's probably the last part of the procedure that they feel. The other needle poke to get the catheter in shouldn't be felt by them, and they should be feeling quite good after that's given. So to summarize, we give the sedative and pain reliever, reduces anxiety and patient movement so we can get the catheter placed, place the catheter, and once it's in, we give the bolus of pentobarbital to help your pet achieve what we think of as a good death.